We'll send you all a copy of the PowerPoint after the presentation is completed. And as Rohini mentioned, please put any questions you have in the Q&A. So I think we can go to the next slide. So what are we going to cover in today's training? We will be doing a brief introduction, then explaining what school avoidance is, what are the rights of school avoidant students, and some tips and strategies for managing school avoidance. Just one thing to note that we are not clinicians or advocates, and so this webinar is going to focus on advocacy rather than clinical treatment, and really hope you'll be able to strengthen your ability to advocate for students who are exhibiting school avoidant behaviors. So we can go to the next slide. So who are we? We're Advocates for Children. We are a nonprofit organization that protects the education rights of all New York City students. We have several services. So we have a helpline that's open from Monday to Thursday from 10 a.m. to 4 p.m. This phone number is right here. And you can feel free to call if you have any questions about your specific circumstances or general questions related to education, special education. Our helpline team is definitely able to help you out. We also offer guides and resources on our website. We do offer workshops and trainings like this one that we're doing today, and we offer free legal services to low-income families. So if you're experiencing an education issue and you'll call our helpline and our team determines that, you might require some more in-depth assistance, they'll be able to help figure out if Advocates for Children can take on your case or not. We also have various projects within our office that serve different populations. So we support early childhood learners, students in temporary housing, students in charter schools, and then our project, the School Justice Project, we support students who are court involved, who've experienced bullying. We do suspension work, and we also support students with behavioral and mental health challenges. And so that's why we are here talking about school avoidance today. So we can go to the next slide. So what is school avoidance? It's really a spectrum of behaviors. Again, we want to highlight that we're not clinicians, but this information comes from trainings that we have done with clinicians. And so school avoidance is a spectrum of behaviors, and that can include complete refusal to go to school, which is what maybe you might think of as a typical school avoidance scenario, but it can also include a large number of absences, skipping classes, being late to school often, or even if your child is going to school, if they're spending a lot of time in like the guidance office or the nurse's office or the bathroom, that might be a sign of school avoidance. Similarly, if it's really hard for your child to get to school in the mornings, that might be a sign of school avoidance as well. In addition to mental health challenges that are listed on the slide, school avoidance can also be linked to conduct challenges and oppositional defiance disorder. And we do especially want to note the connection between school avoidance and academic challenges because we often see school avoidance among students who have other disabilities that are impacting their progress in school. So that might be learning disabilities, speech and language disorder, intellectual disability, etc. And when those underlying needs are not met, students often experience low self-esteem or feel inadequate about their academic abilities, and that can cause them to develop anxiety around school and these school avoidant behaviors that we just mentioned. And as students spend more time away from school, their academic progress becomes even more impacted. So that really creates this kind of a cycle. So we just want to highlight that connection between school avoidance and unmet learning needs. You can go to the next slide. So we just talked about how low self-esteem due to academic challenges can cause a student to develop school avoidance or experience increased school avoidance. That cycle can also go the other way. So if a student is experiencing a separate traumatic event in their life outside of school or existing emotional or mental health challenges, those stressors can compete for a student's attention and energy and overwhelm them and make it harder for them to attend school and, make it harder for the student to learn. And so again, the longer the student is away from school, the less they're learning, the harder it is for them to get back. So that cycle can really go two ways. You can go to the next slide. So why is all of this important? Student social, emotional, and mental wellness is correlated with various things, an increase in grades, attendance, self-esteem, overall child health, and a decrease in absenteeism and emergency room use for mental health services. And I'm sure, as all of you are aware, there is a youth mental health crisis occurring across the US, and it really especially worsened during the pandemic and since the pandemic. And chronic absenteeism is not a perfect measure of school avoidance, but it does help us show the scope of the problem. And in New York City, this past school year in 2024 to 2025, about 33% of students in public schools were chronically absent. So that means missing 18 school days or more. It's a very high number, and we want to be able to support these students. And so just a really important issue. You can go to the next slide. Okay, so what are some of the signs of school avoidance? We talked about this briefly earlier, but some signs might include fear of teachers being upset or fear of teachers not being nice to a student. If your student has is afraid of having challenges with peers like teasing, bullying, adjusting socially with peers, that might be a sign of school avoidance. Often perfectionism about grades and wanting to perform well academically can cause a student, in severe cases, to experience a lot of anxiety around school and not want to attend. Fear of issues in school settings, such as loud noises or fire drills. A fear that parents might not come back or will be harmed when the student's at school, like separation anxiety. Emotional distress and behavior challenges around the time of school, so in the mornings, can often be a sign. And some signs can also include physical symptoms like dizziness, headaches, nausea, stomach aches. Again, we want to note that we're not clinicians, so we're not going to be focusing on the physical or health-related symptoms of school avoidance, but rather on the ways in which school avoidance can show up at school. So we go to the next slide. So students who are experiencing school avoidance are likely going to need support both in and out of school. So outside of school, mental health providers like therapists can use a variety of strategies to help students handle the challenges that are driving the school avoidance in the first place. And these are called therapeutic approaches or treatments. And, the specific treatment is going to depend on a student's individual situations. These are just some common examples. Cognitive behavioral therapy, or CBT. This is an approach that's rooted in the idea that emotional challenges are tied to thinking and behavior that may be distorted. And so this treatment really helps patients identify these patterns in their thinking and changing those patterns of behavior. Exposure therapy is a technique within CBT, and this is where students are exposed to the things that are making them anxious in a really safe and structured way, and it helps them really trigger and then navigate the anxiety, and that is supposed to reduce the anxiety overall. In the context of school avoidance, that can include bringing the student back into a school setting in a gradual manner, so starting with things like just walking or driving near the school, then only going to the school for an hour, maybe to sit in a counselor's office or just going for lunch or for one class, eventually building up to attending school for a full day. And we'll discuss this more later, but this is a strategy that you can discuss with your school for them to implement. And then one other strategy might be teaching coping skills to manage the anxiety. So again, these are more therapeutic approaches, but we did want to just mention them. Go to the next slide. So there are private providers that have school avoidance practices or clinicians who work in related areas and might be able to support students. Unfortunately, many don't take insurance, but we did want to provide the information to you all. So these are just some examples of private providers. Again, we'll give you these slides so that you can click on these links and explore them as well.
Yes, and we should add this is not, this is not inclusive of all. These are just some examples of providers that we're aware of. I'm sure, other folks here might know of others, and feel free to put that, in the chat or the Q&A for others to see. So next we're going to move on to talk about some of the rights of students with school avoidance. And then finally, we'll sort of conclude with talking about some tips and strategies. And so schools must support students with school avoidant behavior by providing appropriate supports and services to address the behavior. So if a student is facing mental health challenges and school avoidance, they may be entitled to certain rights under federal and state law. These rights include the right to an individualized education program or an IEP, and a right to a 504 plan to address the school avoidant behavior. Again, if the mental health challenges are interfering with school performance over this long period of time, we'll be students might be entitled to additional services through one of these two federal laws. Today, we're going to be focusing mostly on rights under the IDEA and the IEP, and not as much under Section 504, because in New York City public schools, most students with school avoidance and school avoidant related needs will be entitled to an IEP, and so they'll be getting their services through the IEP. AFC does have a guide to rights under Section 504, and I encourage you to look at our guide, which is linked to on the slides, which will be sent out after the presentation. If you want further information on 504 rights and how to request a 504 plan and different accommodations that can be included within a 504 plan. So to give a better understanding and to just, give you sort of an overview on parents and students' rights, we're going to have to give a quick overview of what a student is entitled to under the IDEA, or the Individuals with Disabilities Education Act. This is going to be a very quick sort of like brief overview of the IDEA. We do have much more in-depth presentations on special education and special education rights. And so if your student does not have an IEP or you don't know anything about this process, we definitely encourage you to look at those webinars and our trainings and guides on special education. But special education, again, can be its own training, and we encourage you to look at that training. The federal law about special education is called the Individuals with Disabilities Education Act. The IDEA guarantees a free, appropriate public education for each student. This is also known as a FAPE. And the law requires that every student with a disability be educated in the least restrictive environment, or LRE, which means that to the maximum extent possible, a child with a disability should be educated with their non-disabled peers. A student with a disability is entitled to receive the extra academic or behavioral support that will allow the student to progress in the least restrictive environment. So what is a FAPE? A FAPE is defined as programs and services to help the student make appropriate progress in light of their individual circumstances. It could also be defined as specially designed instruction to meet a child's unique needs and achieve challenging objectives. So students that are found eligible for services under the IDEA receive what's known as an individualized education program, or an IEP. The heart of the special education process is the IEP. It tells you whether your student has a disability, whether the student needs special education services. It gives you a sense of their present academic levels, their annual goals, their programs and services, and whether there needs to be modifications to an existing program. So it's a legal document. It's like a contract. Again, it must be individualized. It describes the student and the special education services that the student requires. It must be based on the student's needs and not on the availability of services or programming. And all the services and programs on the IEP must be given to the student. And it must be reviewed every year. It must be revised if expected progress is not achieved. So if your child is experiencing mental health challenges and school avoidance that are interfering with their academic performance, then they're entitled to receive support to help them to receive an appropriate education. And an IEP can include these services and supports to help students manage mental health challenges and school avoidance. Remember that a student will only receive an IEP if they are found to have a disability and be eligible for special education. And on the next slide, we're going to go over some of the categories of disability that are outlined under the law. So just to be clear, classifications on a student's IEP are not a diagnosis. It's more like a category of disability. So a diagnosis is a medical condition, and a diagnosis is the basis for prescribing medicines or behavioral approaches, or for recommending different kinds of therapy for a child and family. And so only a medical doctor or a certified mental health specialist can accurately make a diagnosis. But when a child is classified with a disability, that means that they've met the criteria established by law for being classified with that disability. So again, classifications are not diagnoses. They are but a student is required to be classified under one of these 13 classifications in order to receive special education services. And so your child's IEP will state what their disability is. It can be emotional disability, learning disability, intellectual disability. Specifically, the classification of emotional disability can include mental health challenges such as anxiety and depression that can occur over a long period of time and that adversely impacts the student's educational performance. So students with significant mental health challenges, their IEPs might list that their disability is emotional disability. However, it's important to note that we frequently see school avoidance in students who have other types of disability classifications. It's also important to note that students who are experiencing school avoidance have a right to services to help them return to school regardless of what their disability classification is listed on their IEP. So the disability classification is sort of, it's something you could think of as a student's primary disability or primary needs, and doesn't necessarily capture all of their needs. So students with learning disabilities might also face school avoidance and are still able to get supports for that school avoidance within their IEPs. So as I mentioned earlier, when mental health challenges significantly interfere with school performance over a long period of time, parents and students may be entitled to certain rights under the federal and state law, including rights of the IEP and the 504 plan. The bottom line is that students with school avoidance, again, have the right to services to help them return to school. Okay, turn over to you, Malia.
Great, thank you. So we just want to address school avoidance and push out briefly. Push out is, always something we often see among older students, unfortunately, where students might ask to be by schools to not, to disenroll if they don't have enough credits, or it might not be a deliberate act of, asking a student to disenroll, but essentially the student is not given the support they need and they end up, um, not completing their education. So what we often see for students with school avoidance is that they're not necessarily pushed out of school through that kind of deliberate action, like disenrolling a student. Rather, we often see gradual increasing drops in attendance among students, and then schools often fail to react or take measures in response, and that allows a student essentially to become more and more removed from school. So, in other words, we often see school avoidance students essentially being pushed out due to inaction by schools. And we frequently see this type of inaction by schools towards older students. In New York City, students are required to attend school until the end of the school year when they turn 17. And since students who are older than that are no longer required to be in school, schools do not always take proactive steps to help these students return. And we're going to talk about this a little bit next slide too, but you have rights to services to help your student return to school. And your child has the right to stay in school until the June after their 21st birthday or until they get a high school diploma, whatever comes first. And if you have an IEP, you actually have the right to stay in school until age 22. So we can go to the next slide. So again, as I mentioned, if a student, students have the right to stay in school until the end of the school year in which they turn 17. You have the right to stay in school, meaning you can stay in school through age 21 or when you get a high school diploma, whatever comes first. However, if you're a student with an IEP, you have the right to stay in school until age 22, unless you get your diploma earlier than that. Um, for students who are over 17 and who are absent for 20 consecutive school days, they can be discharged by the school as LTA or long-term absent. However, the school has to schedule a planning interview first before they discharge a student for this reason. And remember that students have the right to re-enroll through age 21 or 22 if they have an IEP. So even if a 17 or 18-year-old is discharged in that manner, they can go back to school until age 21 or 22 if they have an IEP. So you can go to the next slide.
Sorry, just because there was a question about push out, I just want to note here that while students obviously have a right to remain, some schools might ask a 17 or 18-year-old or students that are getting older to withdraw from school, for behavioral issues, for attendance, poor credits, et cetera. And that's something that's what we refer to as push out. So.
Yes, I think we can go to the next slide. So we did want to address some of the legal consequences of missing school and how ACS might be tied to this, since we did get some questions about ACS. So if a student who is 17 and under is absent for 10 plus consecutive days, the school can act as mandated reporters and file for educational neglect with the Administration for Children's Services, or ACS. However, we do want to note that schools are not required to call ACS, and we want to share this information for your knowledge, not to scare you, and this should not deter you from trying to ask your school for help with your child's school avoidance. And if parents communicate with their school, the school should not be calling ACS. The more communication with the school, the less likely they are to call ACS. And in fact, New York City Public Schools actually released updated guidance for schools on reporting educational neglect in March 2025. And this guidance really stresses that for situations like school avoidance, calling ACS should be an option of last resort and should only be done if the child has been impaired or is at imminent risk of impairment due to the absenteeism. And the guidance stresses that school personnel should first work with the student, family, and community agencies to identify needs and resources available to meet those needs. So again, you should still feel free and you should ask your school for help to support the school avoidant behavior, and the more communication with the school, the less likely they are to call ACS. And again, schools can help identify what the reasons for the school avoidance are and help connect students to care where needed, and can also assist with referrals to agencies to support with the school avoidance. We did also get some questions about what the role of the attendance officer is. So, attendance officers should be helping to identify the needs and resources that are mentioned in this guidance. So, what is causing the school avoidance? What resources might help? Unfortunately, we do see this is not often how attendance officers are utilized. And so, if you need support, we would encourage you to ask the school, so your IEP team or the assistant principal for support. And we'd really encourage you to be specific about what's going on and what you would need from them. And you can also ask your school if they can speak to someone in the DOE Central Administration if you're not feeling like you're getting the support you need, and maybe your school doesn't have the resources that you think your child would need to help manage their school avoidance. And Central might be able to provide more support. And if your school does call ACS about your child's absences, especially if they are due to school avoidance or your child's disability, please call our helpline. We're going to have it for you again at the end of this presentation, and we're going to send you all the slides, and we can definitely support with that. So, go to the next slide. So, some common misconceptions we want to address. School avoidance can often be mischaracterized as truancy or mistaken for truancy. So, schools might be characterizing absences that your student is experiencing as truancy. And even if a student is going to school, they may miss classes during the day or appear disengaged during class. And these are also some behaviors that schools might characterize as truancy. But in reality, the student might actually be experiencing school avoidance. So remember that if a student is experiencing significant emotional distress about going to school, which can come up in the form of anxiety, depression, physical symptoms, temper tantrums, or failing to attend classes that might be more challenging for them, they might be experiencing school avoidance and would be entitled to services to help them engage in school. So for any advocates on this call, it's really important that you work with the families you're supporting to distinguish school avoidance from truancy when they're communicating with the school. And one way to do this is to provide a diagnosis that clinically explains the reasons for the behaviors. If a student has a diagnosis from psychiatrist, for example, of generalized anxiety disorder or adjustment disorder, explaining that to the school can help distinguish school avoidance from truancy and then help the student get the services they need. And advocates working with the family should also demonstrate that the family is participating in clinical interventions, and this could also help with any threats of ACS calls for educational neglect. So we can go to the next slide. So I think we'll take a moment here just to pause and answer any questions that have come up.
Yeah, so there have been a few questions that have come up. I know I've answered most of them as they've come in. There are some that maybe we could answer live.
Yeah.
So I guess there's one, sorry, in the chat, there's a few comments here. So that's good to know. So we're no longer called attendance officers, we're called attendance teachers. Thank you for the clarification, Connie. And then someone asks, is referring families to ACS FAPS encouraged by AFC? And that's the ACS Family Assistance Program for those that are not aware. So, I'm not sure exactly what you mean. Are you asking if we encourage parents or if we encourage schools to refer students to ACS FAPS? I think what Malia was discussing earlier was, the policies on whether or not a call should be made or should not be made to ACS regarding attendance. Is that right, Malia? I just want to
Yeah.
make sure we have some clarity on that. Okay. So yeah, I don't know if you want to elaborate on that or answer that question.
Yeah, I think just like um the attendance teacher, should be helping make if they're going to a child's home and should be helping make that connection with the school teams to, so tell the school administration what's happening and help identify services. Again, unfortunately, we see that maybe this is not always happening, but schools really should not be calling ACS in cases of significant absence unless it's one of the reasons that I mentioned. And the guidance really stresses that calling ACS should be a matter of last resort. In terms of services that ACS can offer, that unfortunately is not something I'm as familiar with. And so that's definitely something I think that we can look into um, if that's a question that folks have.
Great. And I know there's a few questions. What are services that can be included in an IEP that help school avoid students return to school? I think we'll be discussing that more in the next section, so we'll definitely get to that. And then there are two specific questions that maybe I'm just going to answer in the chat just for the sake of time about two specific situations. But everyone should be able to see both the questions and the answers in the Q&A. And so if folks are interested in the answer, I can type that through. Oh, I guess Sarah Williams has an answer. How do you define truancy?
Yeah, so I think it's often tricky because, you know, something like truancy and school avoidance can sort of blend together. I think that sort of a typical definition of truancy is maybe more willfully not engaging with school. So if a student is maybe cutting class or not going to school and it's not necessarily related to some underlying trauma or mental health challenges, I think the reality is that for many students, even if it might seem like they're, not going to school or not engaging with school, quote unquote, willfully, there often is some underlying need or challenge that the student is experiencing. So we really, when we are working with students, and communicating with schools about students, we really try to not rely on the term truancy and really try and help schools understand that the young people we are working with are experiencing something else as well. And so we just want to talk about truancy versus school avoidance in case when you're working with the school, they are trying to classify what a student is experiencing as something more willful or just something the student is doing on purpose for no reason versus being tied to some kind of underlying challenge. So hopefully that helps.
Great. All right, so now we're going to move on to talking about some tips and strategies, which I hope answers some of the other questions that folks have. So back over to you, Malia.
Yeah, definitely. So these are some school-based strategies that can be used for all students, not just for students with IEPs. So one strategy that clinicians recommend is to develop a plan for the student to gradually re-engage with school. We mentioned this a little bit earlier. So that might, for example, be starting off by just having one meal at school, just going to one class that's better for the student, maybe art if they're really interested in art, or math if they really love math, going to school for a smaller number of hours, etc. As we discussed earlier, that can be a form of exposure therapy. Now, if there are certain things that motivate your child, you should ask if they can be incorporated into your student's school day. For instance, if your child loves music, ask how music can be incorporated into their lessons or whether they can have a music class in their schedule or some time in the music room. Some schools use point systems, so where students receive points for engaging in good behavior like completing their homework or being respectful in class, etc. And if your school has this type of system, you can ask if it can be adapted to the factors that motivate your child. So if your child loves sports, you can ask if they can receive points for going to PE class and participating in sports, and ask if those points can be exchanged for a reward that the student likes. One other general strategy might be asking your child's school to make a staff member at the school a point person for your child. That can be a teacher, a school psychologist, guidance counselor, assistant principal, really anyone that your child trusts and feels comfortable with. And identifying a point person allows your child to have someone they can go to when they're experiencing emotional distress at school. This person should also be responsible for giving your child encouragement and frequent reminders about coming to school, and ask your school to develop a plan for what happens when the child's point person is out. So maybe there can be a backup or second point person when the first one is absent, so that your child always has someone they can go to if they're experiencing emotional distress in school. And it's really important that your child knows who these people are and where in the school they can find them. Another option might be to ask your school to designate a safe space where your child can go when they're experiencing emotional distress or need a break. Again, that can be a guidance counselor's office, a nurse's office, etc. Sometimes schools have calming rooms or sensory rooms that can be helpful safe spaces for your child if they're experiencing emotional distress. And you can also work with your school to develop a behavior contract. So this sets out the responsibilities that each member of the team that works with your child, so teachers, caregivers, etc., will have in helping your child manage their school avoidant behavior. And again, it's really important that this behavior contract or management plan focuses on positive reinforcement for the student rather than punishments. They can go to the next slide. So if your child's school avoidance is tied to something in their current school environment, or maybe they're motivated by specific opportunities like having work experience, then alternative school programs might help your child re-engage with the school. So one example of an alternative school program is a transfer school. These are academic high schools that are designed to re-engage students who have dropped out or are overage and undercredited. They tend to be smaller with smaller class sizes, advisors, and more individualized attention. And many are connected to a social services agency and offer counseling and job training. They often don't serve students with extensive special education needs, and many are not able to support English language learners, but there are some transfer students that are transfer schools that are specifically for English language learners. And so on the slides, we've included a link to the New York City Department of Education's transfer school guides that you all have that. Now, work-based learning programs, these are something that New York City offers, and they are a variety of free and often school-connected programs that are aimed at preparing students for the workforce, and they offer hands-on experience, skill development, career exploration, and they really designed to help students gain hands-on learning and the opportunities they need to succeed in the future in their careers. So one example of a work-based learning program is Co-op Tech. It's a DOE program. It's a half-day program. So students who are still in high school would go to their home high school for half a day or a high school equivalency program, and then they would go to Co-op Tech for the rest of the day. And at Co-op Tech, they can enroll in programs like building trades, healthcare, IT, service industries, a variety of programs, and they can, pass state licensing exams and get paid internships. So for students who really like hands-on learning and where, taking exams might be difficult for them, this could be a really great option because students who do work-based learning might be able to qualify for a credential called CDOS, and that replaces a Regents exam. And so this can be a really good student option for students who are experiencing anxiety and school avoidance because of test taking or maybe more intensive academic environments. And so we wanted to mention those as well. And we are linking to our Advocates for Children's guide on transition services at college planning and includes information on work-based learning programs as well. Now we're going to talk about home instruction, so we can go to the next slide to get more into that. So we did get some questions on home instruction. This is also called medically necessary instruction. It's meant for students who cannot attend school for 4 weeks or more due to orthopedic, other medical or psychiatric challenges. There are some benefits and drawbacks of home instruction. The benefits are that it prevents further academic regression, while the student, in the case of school avoidance, might be experiencing acute emotional distress. And it can be remote, which is a good option for students that might feel overwhelmed by the workload of high school. Their drawbacks is that it can reinforce a student's school avoidant behavior because, they're staying home for more and more time. Home instruction also requires a referral from a psychiatrist, and wait lists for psychiatrists can be long. The other thing is that home instruction is only 10 hours per week for students in grades 7 to 12, so you accrue credits more slowly. And we do want to stress that home instruction should only be a temporary measure, not a permanent way for the student to complete their education. So more information on home instruction, including how to apply, can be found at the website for Home Instruction Schools, which is the New York City DOE program that administers this type of instruction, and we have included that link on the slide. I can go to the next slide. So as we mentioned earlier in this training, students with school avoidance will likely need support both inside and outside of school. And so these are just some examples of strategies outside of school that might help your child in managing their school avoidance. One option is to try to connect the student with a mental health provider. We do recognize that many organizations that offer access to therapists for free or low cost have long wait lists. NYC 988 has a website where you can look for mental health providers based on specific issues that you need help with. And it also has a chat feature where you can chat electronically with a counselor 24/7. And then we've included the link for the website for NYC 988 on these slides, and it also has telephone interpretation in more than 200 languages. Another out-of-school option might be looking for mentorship or other programs that might be a good fit for the student based on what motivates them. So for instance, if a student is very motivated by sports, then an after-school sports program might be something that can help them re-engage. So you can go to the next slide. So the strategies that we have discussed so far can be tried for any student, whether or not they have an IEP. Now we will transition to talking about how to get supports through the IEP process. So if a student is really struggling and their school avoidance is really impacting their ability to engage with academics, then it might be worth getting something called an independent assessment authorization or an IAA. An IAA is a voucher that the DOE will give you if they agree to pay for an evaluation or assessment done by an independent provider outside the school. So one example of this type of an evaluation is a neuropsychological evaluation. It involves a series of tests that evaluate various aspects of a student's cognitive skills, like attention, memory, language, executive functioning, and it also evaluates a student's academic abilities and touches on socio-emotional challenges that a student may be experiencing, including challenges that adapting to or adjusting to the community or school environments. The DOE does not do their own neuropsychological evaluation, so you can ask for an IAA to get a neuropsychological evaluation done by an outside clinician. Another type of evaluation that you can ask for is called a functional behavioral assessment, or FBA. We will talk more about what an FBA is on a later slide, but the really key thing to note is that unlike the DOE's evaluations, these independent evaluations will make recommendations for the type of supports and accommodations that your child needs to learn in school. And these evaluations can help identify the cause of a student's school avoidance and can make recommendations for the things that your child's school should do to help them manage the school avoidance. So, for example, if a student's school avoidance is tied to shame about their academic skills, an evaluation might recommend a smaller or different type of classroom or school. So, an IAA for an independent evaluation is a really great place to start. And if we can go to the next slide. We have an example of just how to request an independent assessment authorization. It doesn't have to be anything long, but we do encourage you to send this type of a request in writing. It can be an email along the lines of what we have on this slide, just explaining why you're concerned and including details about the challenges that your child is having. So we can go to the next slide. So I'm
Great.
going to pass it back to you, Rohini.
Sure. Yes. So if your child receives an IEP after they've been evaluated, there will be an initial meeting to create the IEP, and later meetings to review and revise IEPs. And all IEP meetings must be conducted by an IEP team. As a parent, you are a legally required member of the IEP team, and so you must have the opportunity to participate equally in decision-making with the other team members. Other required team members include a special education teacher or provider. This member must be your child's actual teacher or service provider if your child already receives special education services, a general education teacher if your child is or may be participating in a general education class, your child, when appropriate, the school psychologist or a member who can explain the meaning of the evaluations to the team. The team must also include a school psychologist if a new psychological evaluation has been done or if it'll be recommending a more restrictive environment for your child. A district representative who is qualified to supervise special education, who knows the standard grade level curriculum and is familiar with the educational resources available in the district. Some additional team members may include a school physician, your child's related services providers or therapists, and anyone you invite. So a parent may invite anyone else to the IEP meeting for support or information, including anyone having knowledge or special expertise regarding your child. So this can be an outside therapist, a tutor, the person who conducted the independent evaluation, or other specialists. These additional team members may participate in the IEP meeting in person or by phone. So if you've gotten an independent evaluation to address your child's school avoidance, you can ask to discuss that at the meeting and ask for the evaluator to be present at the meeting. You can also watch AFC's webinar on Special Education 101 for more information about the IEP development process. If you're, if this is your child's first IEP, and also you can look at AFC's worksheet for parents on preparing for an IEP meeting, so you feel ready to discuss your child's needs at the IEP meeting, and that's linked to on this slide here. And so at the IEP meeting, you can advocate for supports. It's really important to describe your child's mental health challenges and ask for that language to be included in the IEP. One type of support that you can request is an FBA or BIP, or FBA and BIP. So an FBA, as Maliha mentioned briefly before, is an evaluation that can be done to figure out what is causing your child's behavior. During an FBA, school staff will observe your child in different settings, collect interviews of you and other adults in your child's life, and gather your child's past evaluations and records in order to create a written document that explains, one, what behaviors or behaviors are causing difficulties for the student, what causes or leads to the behavior or behaviors, Why does your child continue to use the behavior? Once this information is gathered, you and the school can make a plan for addressing the behavior through a behavior intervention plan. So New York City's Special Education Manual states clearly that an FBA should be considered anytime a student's behavior impacts their learning, including school avoidance. This is within, again, the New York City Department of Education Standard Operating Procedural Manual. Standard Operating Procedurals Manual. And if the school says that they're unable to do an FBA or develop a BIP because the student is not in attendance, or because the student's not in school, you can ask them to note your requests in the parent concern section of the IEP and ask to speak to the supervisor of psychologists for your school. Again, school avoidance is a behavior. It's often a disability-related behavior, and so it should be something that is addressed through an FBA or BIP. So what goes in a BIP? So once an FBA is done, the team must use the FBA to create a BIP or behavior intervention plan that will prevent and address the behavior and promote positive behavior. So the BIP must include information about when and how the behavior happens and how severe it is, strategies for stopping the behavior from happening, which could include classroom changes, a new school schedule. For school avoidance students, this can include strategies of exposure therapy or other therapies or strategies that can help the student return to or engage in school or re-engage in school. For instance, the type of gradual transition plan that we had discussed earlier, where a student might start by coming back to school for 1 hour per day, might be one such strategy that's included within a behavior intervention plan for school avoidance. There should also be within a BIP, or could also be within a BIP, a safety plan for how to manage the behavior when it does happen, such as calming the student down, removing the student from the classroom if appropriate, or having the student speak with a trusted adult. There should be specific school staff listed in the BIP who your child trusts, who will be designated to work to support your child and will be available to safely work with your child when a behavior occurs. And then within the BIP, there also must be a schedule to mark progress and set future meetings so that you can remain up to date on how well the BIP is working and make changes if you feel they are needed. So it's important to assess whether all staff who interact with your child are fully implementing and are aware of the student's BIP. And if not, the school should provide coaching and implementation support. If with proper implementation, the student is not progressing under the BIP, then it may need to be changed. As Malie had mentioned earlier, if you don't want a DOE employee or someone within the school to do the functional behavior assessment, then you can pay for an independent assessment. Medicaid may cover the cost. If the DOE has already done a functional behavior evaluation but you disagree with the findings or disagree with the analysis of your child's behavior, you can, as Malia mentioned earlier, you can ask the DOE to pay for an independent evaluator to do an FBA. To do this, send a letter or email to the IEP team or the Committee on Special Education. If the DOE agrees to pay for the independent assessment, then they'll provide the independent assessment authorization voucher or the IAA, agreeing that they will pay for the independent functional behavior assessment. For more information, just generally about functional behavior assessments and behavior intervention plans, you can look at our tip sheet on supports for students with behavioral needs. So in addition to an FBA or BIP, which again is the primary behavior support available to students students with disabilities within an IEP, there are some additional supports that you can ask for at the IEP meeting to address your child's school avoidance. And these can include strategies for school avoidance in the management needs section of the IEP. So specific adjustments to a school schedule, access to quiet spaces or breaks. I know there was one question that folks sent in before the webinar about a modified schedule. Unfortunately, we often try to advocate for modified schedules, and some schools will allow for some flexibility, especially as a student is, re-engaging in school. But a permanent modified schedule is not something that that might not be possible, mainly due to restrictions on seat time within that schools must abide by in order to issue credits. And so, again, some schools might be willing to offer some flexibility, but that's the modified schedule or a permit modified schedule is something that's that is just unfortunately more difficult to advocate for, even as an IEP service. Um, in addition, you could also advocate within an IEP for specific training for school staff on therapeutic approaches. So this would go in the section for supports for school personnel on behalf of the student within an IEP. And this section, you can ask the school to include training for staff on exposure therapy or other therapeutic approaches or strategies that you and the IEP team decide are needed to help your child manage their school avoidance. We have a tip sheet, as I mentioned before, on behavior and mental health supports in school, which could be useful. Again, it applies more broadly to all behaviors and mental health supports, but there are some specific supports there that can be really helpful for students with school avoidance. So when to call AFC. So we encourage you to call AFC's helpline. The number will be, it was at the start of the presentation, it will also be at the end of the presentation. But you can give us a call if a school will not grant an independent assessment authorization for an independent evaluation. If the school will not conduct a functional behavior assessment or develop a behavioral intervention plan, schools, again, we had mentioned this before, often say that they can't conduct an FBA or develop a BIP until the student is coming to school. We encourage you to call us if this happens. We have, again, school avoidance is a behavior. It's specifically, often a behavior related to a student's disability, and it's clearly impacting their academic performance. And so, we want to try to push schools to conduct these assessments and do these behavior plans to help create strategies or, to help develop strategies to get a student to re-engage and go back to school. If the school is trying to work with you on school-based solutions that we talked about, but your child is still having difficulty attending school, you can give us a call. If your school is disenrolled from school, removed from class, suspended for school, or otherwise disciplined because of attendance or school avoidant related behaviors, that's another reason why you could give us a call. Great. And we have some time. Let's pause here to take some questions. I don't know, Maliha, if you.
Yeah, I've been trying to answer a bunch of them. Um, I think while we're on the topic of FBAs and BIPs, some folks are asking if only students with an IEP can have an FBA conducted. My understanding is that anyone can have an FBA conducted or to have a behavior intervention plan. Rohini, feel free to jump in if you've experienced otherwise. Um, Someone else is asking, what do you recommend if a school says that they will analyze the data, develop a BIP without actually conducting an FBA? I think if the school is willing to develop the behavior intervention plan and you are satisfied with the recommendations that they are giving, that I think is fine. But I think if you are feeling like the behavior intervention plan is being developed in a very punitive way or it's missing some data, then I would encourage you to ask for the FBA first. Rohini, feel free to jump in if there's anything else you want to add on that.
Yeah,
One thing,
oh,
sorry, go ahead.
sorry. I was just reading the questions back. So yeah, just on the question of the IEP students can have an FBA conducted if it's only IEP students. So yes, technically, all students, you can ask for a functional behavior assessment even if your child does not have an IEP. But typically, when it does happen in practice, oftentimes that'll open an IEP process. So, in order to do the FBA, a parent would have to sign consent for the evaluations, because it's sort of considered a special education evaluation. But yes, I like in practice, a student should be able to have an FBA done without an IEP in place. So, yeah.
One question I did want to address because I know a lot of folks do have this question about online high school. So I think this is like a challenge that many of us are experiencing is that unfortunately there aren't really that many fully online or any fully online high schools that are, might be able to also provide the mental health supports and special education supports that the student requires. And in terms of, New York City public school funded programs, they pretty much always do have some kind of in-person component as well. And so this is definitely a challenge. I think the closest thing would probably be home instruction, but as we mentioned, that there are some drawbacks with home instruction in that you don't accrue credits as quickly as you would in a full-time educational program. But home instruction can definitely be a temporary first solution for students who are looking for the online options. Some transfer schools do have online components to their program. So, for example, I can think of one transfer school where if a student has a lot of credits already, then they can do some of their work online. But again, this would be a situation where if a student already has a lot of credits and just needs a little bit more in order to get their diploma. And so, um, I think applies in very specific situations. How likely is an IA request to be approved? I think that it does depend on the circumstances, but if you request it, if you put in an IAA request, the school either has to give you the request or um, if they deny it, and you disagree with the findings of that, they are supposed to initiate something called an impartial hearing. And so really they should be responding in one of two ways. And so if the school is just denying, but then not really taking any further steps, then definitely suggest that you call our helpline because they're either supposed to give you the evaluation, or if they don't and you disagree, then they're supposed to initiate like a process. And so if they're not doing that, then they are in violation. So encourage you to call our helpline in that kind of a situation, or to email the special education inbox of the central administration. It's all on New York City Public Schools website, and explain the situation that's happening. I think we've answered the general questions. I'm just looking at the chat.
I know we had one question here. I was going to type out a response, but I'm happy to try to answer it live about a child that was found ineligible for an IEP, and the parent is seeking counseling. So this is a situation where you could advocate for counseling as part of a 504 plan if they're found not eligible for an IEP. Again, this is like a very fact-specific situation, and we definitely encourage you to call our helpline if you want to talk through the specifics, or email us at our info email address. And I can actually just put that slide up so folks can see it. But if a student is not found eligible for IEP services, but they do have a disability, you could potentially get accommodations or services through a 504 plan. I should say that if a student is experiencing school avoidance, and attendance is an issue, even though they might be getting even though their grades are okay, or if they're still passing, or something like that, and the school's saying it's not impacting their educational performance, I think there is an argument, obviously, like attending school, being able to engage in school. Those are all key aspects of a student's education. And so you might, also an option might be to potentially challenge, the determination that he was ineligible for special education services through a due process hearing. So again, that's probably more information than we can give on this in a minute in this presentation, but we definitely encourage you to reach out to our helpline to look at our 504 guide, and then also our guide to impartial hearings as well. And I think, okay, we have a few more questions here.
And while we're answering these questions, I'm going to put the link for our survey in the chat. You can also find the survey from our QR code here on the slide. If you could please fill out our survey again, it's really helpful for us to get everyone's feedback and learn how we can keep improving these webinars. So if you could please take our survey, we'd really appreciate it. It just takes 2 minutes.
All right. I see we have some. How does this mainly change when the student turns 18, but the parent is the main advocate? So a parent still holds a student's special education rights even when a student is 18. And so when it comes to advocating for services in an IEP, until a child is no longer ineligible, so until they turn 22, the parent is still is is the one that holds those rights, and so they're the primary advocate. But I should say, when a student turns 18, obviously they're no longer compulsory school age. It can get more challenging. That's when it's certainly, I mean, even before then, but at that point, it's really important to work together with the young person to make sure that there's sort of like you have an understanding of their needs and the reasons behind the school avoidance and trying to address them. So I hope that answers your question about that. Um,
And I think we had one remaining question about the time period for starting the evaluation. So, for special education, the initial evaluation, once that referral for the evaluation is put in, the school has 60 days to conduct those evaluations. I think that we've covered everyone's questions. Again, if you could please fill out our survey, we'll be here for a few moments so you can access the link. Again, it's really helpful for us to get everyone's feedback. And thank you all so much for attending, for all of your engagement in these questions. And again, as Rohini said, feel free to reach out to our helpline or email this address if you have any questions.